Every 2 minutes, a woman is diagnosed with cervical cancer worldwide. That's over 500,000 women each year. Now let's pause for a moment and let these numbers sink in. It's a staggering reality that many of us are not fully aware of. Cervical cancer, a type of cancer that develops in the cervix, the lower part of the uterus that connects to the vagina, is one of the most common cancers in women globally. Yet, it's a disease that remains unseen and unspoken about in many societies. In the grand scheme of things, cervical cancer is a silent predator. It is silent because its symptoms often go unnoticed until the disease has advanced. It's a predator because it preys on women of all ages, from all walks of life, and in every corner of the globe. But why is it unseen? The answer lies in the lack of awareness and understanding about this disease. Many are unaware of the risk factors associated with cervical cancer. These include having a weak immune system, smoking, long-term use of oral contraceptives, and having multiple sexual partners, among others. However, the most significant risk factor is persistent infection with certain types of human papillomavirus or HPV. Awareness about the symptoms is equally important. Although early stages of cervical cancer may not cause signs or symptoms, advanced cervical cancer may cause bleeding or discharge from the vagina that is not normal, pelvic pain, or pain during sexual intercourse. It's crucial to note that these symptoms don't necessarily mean you have cervical cancer, but they should be checked out by your doctor. Yet, despite its prevalence and potential severity, cervical cancer is also one of the most preventable types of cancer, provided that it's detected early. Vaccines that protect against HPV infection are available, and regular screening tests can identify precancerous changes in the cervix that might lead to cervical cancer. Cervical cancer isn't just statistics, it's a reality affecting countless lives. But knowledge is power, and understanding this disease is the first step to prevention. Did you know? Over 99% of cervical cancer cases are linked to a common virus called the human papillomavirus or HPV. HPV is not just one virus. Instead, it's a group of more than 100 related viruses. Now that might sound a tad overwhelming, but fear not. Not all of these viruses cause cervical cancer. Some types of HPV are classified as high risk because they can lead to different types of cancer, including cervical cancer. But before we delve into the gloomy side, let's shed some light on the brighter aspects. Most HPV infections are usually harmless, and our body's immune system does a pretty good job at clearing them up without any intervention. It's like having a personal superhero inside us, fighting off these villains on a daily basis. However, there are instances when our superhero needs a little help. This is where persistent infection with high-risk HPV types can become a problem. If left unchecked, these types of HPV can lead to cell changes that may eventually become cancerous. Imagine a beautiful garden, filled with vibrant flowers and lush green plants. Now, imagine a few weeds growing amidst this beauty. If we don't pluck out these weeds in time, they might overgrow and ruin our lovely garden. The same thing happens in our body. If we don't keep an eye on these weeds, the high-risk HPV types, they might lead to something we never want to face. But remember, knowledge is power. By understanding how HPV works, we can better equip ourselves to prevent, detect, and treat HPV-related conditions. The link between HPV and cervical cancer is clear, but there's good news. We have the power to combat this virus. So, let's continue our journey to empower ourselves with knowledge and foster a healthier tomorrow. Stay tuned as we delve deeper into recognizing the symptoms of cervical cancer in our next scene. Early detection can save lives. Knowing the symptoms of cervical cancer is crucial. This statement holds an immense amount of truth. It's like having a roadmap to navigate your way to better health. So, let's dive in and understand the common symptoms of cervical cancer. First on our list is abnormal vaginal bleeding. This can occur between regular menstrual periods, after sexual intercourse, after menopause, and even as unusually heavy menstrual periods. If you notice any unusual bleeding, it's important to consult with your healthcare provider. Next is pain during intercourse. This is a symptom that is often overlooked as many women may attribute it to other factors. But it's important to remember that pain during intercourse is not normal and could be a sign of cervical cancer. Then, we have pelvic pain. This is not your typical cramps associated with menstruation. It's a dull ache that may intensify to become a sharp pain and doesn't go away. If you experience persistent pelvic pain, it's time to book an appointment with your doctor. Now, it's important to remember that these symptoms do not always mean someone has cervical cancer. They could be linked to other health conditions. However, these symptoms should not be ignored. They are like warning sirens, alerting you that something is not right with your body. So what should you do if you experience any of these symptoms? Reach out to a healthcare provider. Don't let fear or embarrassment stop you. Remember, these professionals are there to help, not to judge. Let's underscore this. Early detection is the cornerstone of successful treatment. The sooner the diagnosis, the more effective the treatment can be. You don't have to be a medical expert to recognize the symptoms. You just need to be in tune with your body and take note of any changes. Remember, early detection is key. If you experience any of these symptoms, don't hesitate to seek medical advice. Be proactive about your health. It's the best investment you can make for a healthier tomorrow. Cervical cancer is preventable. Two powerful tools in our arsenal are vaccination and regular screening. Let's delve into the first tool, the HPV vaccine. This is a mighty weapon that helps protect against the types of human papillomavirus, or HPV, that most often cause cervical cancer. The vaccine is usually given to children and young adults, but even if you didn't get vaccinated as a child, you can still benefit from it as an adult. It's never too late to fortify your defenses against HPV. But remember, while the vaccine is highly effective, it doesn't protect against all types of HPV that can cause cervical cancer, which is why our second tool, regular screening, is equally important. Now let's talk about regular screening. Two tests can help prevent cervical cancer or find it early. The PAP test, or Pap smear, looks for precancers, cell changes on the cervix that may become cervical cancer if not treated appropriately. The HPV test looks for the virus that can cause these cell changes. Both tests can be done in a doctor's office or clinic, and they are both crucial in catching cervical cancer in its earliest stages, when it's most treatable. But how often should you get screened? Generally, women aged 21 to 65 should get Pap tests every 3 years. Starting at age 30, women should get an HPV test every 5 years, a Pap test every 3 years, or a combination of both every 5 years. But these are just general guidelines. Always consult with your healthcare provider to determine the best screening schedule for you. And don't forget, even if you're vaccinated, regular screening is still necessary. Think of these two tools as partners, working together to give you the best chance of preventing cervical cancer. Prevention is better than cure. Vaccination and regular screening can make all the difference. Together, let's continue to empower our knowledge, leading us all to a healthier tomorrow. Every woman deserves to live a healthy, cancer-free life, and that starts with knowledge. Knowledge is our greatest weapon in the battle against cervical cancer. We are not helpless. In fact, we are far from it. We possess the power to change the narrative, to shift the statistics, and to rewrite the ending for countless lives. The key to this power lies in our ability to share what we know, to educate and enlighten those around us, to bring the conversation about cervical cancer out of the shadows and into the light. Imagine a world where every woman, regardless of her age, race, or economic status, is armed with the information she needs to protect herself against this disease. A world where the words cervical cancer no longer elicit fear, but are met with understanding and proactive measures. This is the world we can create through the power of shared knowledge. Sharing what you've learned about cervical cancer doesn't just benefit you, it can potentially save lives. When you talk about the importance of regular screenings and vaccinations, when you encourage those around you to be vigilant about their health, you're creating a ripple effect of awareness and prevention. But this is not a journey we embark on alone. It's a collective effort. Doctors, nurses, researchers, educators, families, friends, we all have a role to play in this fight. We must all join forces to spread the message far and wide to ensure that no woman is left uninformed or unprotected. We can't change the past, but we have immense control over our future. By empowering ourselves and others with knowledge, by fostering a culture of open dialogue and preventative healthcare, we are paving the way for a healthier, cancer-free tomorrow. So, let's harness the power of information. Let's share our knowledge, our stories, our experiences. Let's stand together, united in our fight against cervical cancer. Together we can make a difference. Let's create a healthier tomorrow, free from the threat of cervical cancer.